is actually at this angle. It puts a lot of stress on the big toe, which therefore puts a lot of stresses in the joint, which also turns the foot at an angle. That angulation of the foot is what we call bunion formations, or too tight or too narrow. It causes these toes to actually start to imbricate and cause pressure. And in between the toes, there's a lot of small nerves that supply the joints of the toes and the toes area. And that can cause irritation, which leads to Morton's neuroma, where the nerves get inflamed and cause some damages as well. But when a person has some imbalance to the spine, that can cause off-kiltering of the pelvis, which also causes changes in the direction of the femurs and leg, which also changes the direction of the feet as well. He contacts the heel, and as you notice, this is what we call supination, where the foot starts to roll out, okay? And that's when his knees are extended fully. Then in the mid-stance, he changes where the foot starts to get flatter, and as he toes off, the foot starts to pronate. So now, a lot of times when people don't have proper balance to the muscle and it changes the alignment of the ankle related to the knee and hip, where the people can cause damage by spraining the ankle as well as splaining the Achilles tendon. And as the person goes into mid-stage, into the forefoot, into overpronation, they overpronate because of the bunion. That could also cause stresses to the plantar fascia muscle into the heel, which we're going to explain. You can see his foot starts to arch up. This is what we call windlass effect. So when the foot starts to arch up, that creates the muscles beneath here called plantar fascia, or the connective tissue, to help relax. So as the arch goes up, the plantar fascia muscle starts to kind of shorten, allowing creation of a triangle called windlass. It's like a sailboat, okay? Now, poor mechanics of their feet. Their foot does not move very well. That's when the muscle does not relax, and it keeps pulling on the heel, which also causes eventual arthritis and bone spur on the heel, and that leads to pain and inflammation. That's when people get up in the morning, and the first step that they take, they're having a lot of pain here. There's weakness in this muscle called posterior tibialis. There's weakness on the muscle called popliteal muscle. That could be related to the knee and the hip and the spine, which also affects that. So how this muscle, when it's strong enough, allows proper cushioning. Now, let's say if this muscle is not firing, it's not activating, that causes the arch to collapse, and there is no shock absorption, which leads to plantar fasciitis. This muscle is controlled by a nerve right here in the lower back called L5, right here. So when a person has back injury or disc herniation, that also directly leads. It's not just the foot, it could be related to this region as well. That popliteal muscle connects from your thigh bone into the tibia, and it's responsible for bending the right knee slightly, mid-face and then toe off. His knee's bending. That knee bend is actually controlled by that muscle.
It's called kidney 2. So if you locate inside the foot, so just a little bit under the navicular bone, so it's on in here, so we can gentle massage it. If you feel a little bit, okay, then start to here. Yeah, so this is a kidney 6. We can put a spot there. Okay, that's good. Another one is also in between the tip of the ankle to the Achilles tendon on the midway of the point in here. Yeah, this we can do massage in here to release the tension of the sinew. The calf, just a little bit under and a little bit in front of the head of the fibula. So you will feel a depression in here. That's the point. Tower to the lower back, you got top, and so we can do it.
That allows the cross-legged and open up the hip joint. And as he starts to lean forward, that kind of stretches to the glutes and buttock area. Okay? And as he keeps putting on the wall, put your hand up here and touching closer around the belly of the muscle, and that's it. And then you can kind of turn the legs around and stretch the anterior shin of the muscles as well. You can do that, okay? Now, step off to the side, cross the leg over, and using the arm to help stretch the thigh. Now, at first, it's gonna feel very uncomfortable, and make sure you use this leg to take the pressure off. And the person who wants a little bit more pressure, he can kind of lean out and help stretch that as well. And what Ethan's gonna do is he's going to relax and he's gonna just kind of sit it in like this. Okay, is that too much pressure? Okay, and I can lighten up a little bit. So this allows the muscle called posterior tibialis to help getting a workout. It's like a bicep curl, but for this muscles as well. He does that, and keeping the knee straight. This is going to be here, and what he's going to do is from internal rotation, he's going to go external rotation. Okay? This will allow these muscles and these points to get stronger. So you can see GB34 and UB60 is the same alignment of this muscle that we're training. So he comes out, keeping the knee straight, and out. And from here, he's gonna come up and pull up. So you can see from his shin, a lot of times when people have foot problem, what do? They go for orthotic right away. Okay? We do orthotics. We work with a podiatrist and a company that's very, very good to make functional orthotic. And I do highly recommend people to get orthotic. However, that's not the first thing that we should do. What we should do for treatment purposes, down some adhesion, and of course acupuncture from myself as well as Dr. Wu, and massage therapy, and also eventually orthotics. So the orthotic is, in my opinion, the last thing that people should do, or in between, not the first. It's like doing an alignment on a car. If the car is keep going to the right, you don't get a new tire. You have to make sure everything is in check, and then change the tire, right? So tire is like the orthotic. Don't go for the orthotic right away. There are things that we need to check: your knee, your foot, your back. That can be unbalanced. So once that's corrected, then get the orthotic check to support the correction that we've done. So just check our website for updates. But those of you who have some foot problem, rather than just stay home and wonder and frustrated about these challenges, we welcome you to give us a call, and I can do a free on the phone consultation. It could take about 5-10 minutes. Hear about your history, what the problem may be, and give you some advice and some recommendation. And if there's something that we can do to try and help you, I'm going to invite you over to come into our clinic, and we'll give you a discounted rate on the checkup and give you our expertise and help you to assist you. This is what we do. We actually help people with this all the time, and we're very confident to help. And we love doing this kind of presentation to help share information to people. But knowing is half the battle. However, taking that knowledge and taking the step to improve it is also very, very important as well.